So traditionally, people with cancer have been advised to rest due to things such as fatigue and concerns about immunosuppression. However, there's mounting evidence that exercise is beneficial for people with cancer, and these can be things, anything from symptoms such as pain, fatigue, managing lymphedema, improved mobility and strength and mood, and even the potential to affect survival. However, there's this question that is exercise actually safe for people with cancer, and this is something that we endeavoured to answer in our recent systematic review. So generally, in previous research that's been done, there's a low number of adverse events for people with cancer. At a physiological level though, we don't know in terms of exercise dose whether exercise is safe, particularly in relation to things like inflammation. So traditionally people with cancer have been advised to rest with concerns about things such as fatigue and immunosuppression. However, exercise is really beneficial for cancer survivors. There's research to show that it can improve symptoms, so things like pain, fatigue, improving lymphedema risk, also things like mood, improved strength and function, and there's even the possibility that exercise can enhance survival. However, what's not known is whether exercise is really safe. And we think it is because previous research has shown that there's a low number of adverse events that happen in relation to exercise. But from a physiological perspective, we don't really know so much what is happening, especially in relation to exercise dose. And this is something that we endeavoured to find out with our recent systematic review. And overall, our results showed that exercise is safe. So there was a low risk of adverse events, again, like has been mentioned previously, and also exercise does not change levels of inflammation, which is important because inflammation has been attributed to the development of cancers and tumour progression. So what type of exercise is beneficial for people with cancer? So this can depend on what outcome you're trying to achieve. So is it things like strength or bone density? Is it fitness or is it fatigue? Our review aimed to find out what dose of exercise is best for improving fatigue, which may affect function. And overall, it seems that a combination of aerobic and resistance exercise is best for reducing fatigue. And when we break this down a little bit more closely, it's moderate intensity aerobic exercise, so brisk walking, cycling, those sorts of things, that seem to be most beneficial for reducing fatigue. And it's moderate intensity aerobic exercise that again seems to be most beneficial for improving fitness. So overall, the results from our research show that exercise is safe for people with cancer and supports current guidelines to remain as active as possible with a cancer diagnosis.